Namaste. A very good morning, good afternoon, and good evening to all of you who have joined from different parts of the world. Welcome to the seventh session of She and Rights, that is, Sexual Health with Equity and Rights Initiative. Today's session is focused on a very critical and important theme, that is, impact on gender justice and health during conflicts or other humanitarian crises. She and Rights sessions are hosted by Global Center for Health Diplomacy and Inclusion and CNS, together with International Planned Parenthood Federation, Asian Pacific Resource and Research Center for Women, Women's Global Network for Reproductive Rights, and Asia Pacific Media Alliance for Health and Development. Today's entire session of She and Rights is also being live streamed on Dr. Reddy's TSPR media channel. Dr. Reddy is a medical doctor and founder editor of this channel. A few quick housekeeping announcements before we begin. Participants can please type in their questions and comments in the chat box even as the speakers present. You do not have to wait till the end of the session to do so. Please also mention the name of your organization. We will take up as many relevant questions as time permits after all speakers have presented. Also, please keep yourself muted as speakers present. Thank you for your attention. Before we begin, let us take a moment to shine a spotlight on 28th of May. We know 28th May is observed as International Day of Action for Women's Health, when all of us mobilize, take action, and amplify demands for sexual and reproductive health and rights and justice for all, through inclusive, accessible, and available sexual rights and health information and services. Let us listen to Debanjana Chaudhary, who leads the Women's Global Network for Reproductive Rights, or what we call WGNRR. She is one of the co-hosts of She and Rights also. Please wait for a second.
I'm Debanjana Chaudhary from Women's Global Network for Reproductive Rights, WGNRR. I'm so happy to call all of you here and to see all of you. And this is a call to action to join hands for May 28th, the International Day of Action for Women's Health. It is just around the corner, and we are excited to invite you to join us for the Global Dialogues, a key moment to connect, strategize, and ignite collective action. Last year, we saw that over 70 national elections took place, and some of the effects of these electoral outcomes are still being felt very, very strongly at the Global South. The reinstatement of the expanded global gag rule, compiled and coupled with right-wing nationalist and religious fundamentalist movements, has emboldened the efforts of anti-choice to roll back and push back our reproductive freedom and gender equality. So join us and create the space. Let's co-create and co-design what we want to do on May 28th. There would be offline actions and online actions and a chance to be together with a host of, activists, passionate individuals, organizations from across the globe. I really hope you are going to join the Global Dialogues. Thank you.
Thank you, Devanjana. Friends, please do visit the website www.may28.org and join forces with the organizing of International Day of Action for Women's Health on 28th May. Moving forward, we have a formidable panel of speakers today who will share their insights as well as lived experiences on the impact on gender justice and health during conflicts or other humanitarian crises. Today's session will also feature highlights of the Lancet Commission on Gender and Global Health report, which was released just 2 weeks ago. Gender inequality is in itself a perpetual humanitarian crisis which girls and women and gender diverse peoples have been facing on an ongoing daily basis historically. Perhaps there may not be a single girl or woman or gender diverse person on this planet who can say that he or she or they have never ever faced any type of violence or abuse or threat. The threat and danger of sexual and other forms of gender based violence haunts so many of us every moment, sometimes even inside our homes. Wars and conflicts, extreme climate events, religious bigotry, or other forms of humanitarian crisis exacerbate gender inequality and violations of human rights manifold. Without any further ado, I would invite our first speaker for today, Parveen Hussaini of Afghanistan. Parveen serves as a program associate at Roshaniya, a LGBTQIA plus rights group. She is at risk of her life along with her lesbian lover, Mariam Ravish. I hope Parveen is there and I invite her to say a few words and share her experiences. Is Parveen there? Yes, Parveen. Please unmute yourself.
Hello, Parvin. Welcome. Please speak.
Hello, thank you.
Yes, Nimat, welcome. Yes, please translate. Yes. Nimat, can you just try one more time, please?
Yes.
Yes, we can hear you. Good.
Hi there. Hi everyone. This is Nimat Sadat. So I'm CEO of Roshania. I'll be happy to translate for Parveen. So Parveen John, if you can speak in Farsi and Dari, and I will translate for you. Please introduce yourself. لطفاً خودم معرفی کنین. و با من باز ترجمانیتون میکنم.
سلام، امیدوارم همگیتان خوب باشین. من پروین حسینی هستم از ولایت کابل، متولد ولایت غزنی ولی بزرگ شده ولایت کابل و 20 ساله.
Hello everyone. My name is Parveen. I was born in Ghazni province of Afghanistan and raised in Kabul, and I'm happy to be here today.
Parveen, would you like to share your experiences with us?
پروین جان میگه که اگه میتونین که تجربیتون توضیح بدین بر ما.
به عنوان یک زن در افغانستان یا یک لزبیان؟
بر رئیس یک لزبیان نه.
خب تجربه چندان خوبی نبود، یک تجربه خیلی بد کشوری مثل افغانستان و هم برای زنایی که برای خانوما که مثلا حتی حق بیرون رفتن از خانه داده نمیشد، حق کار کردن و حق تحصیل کردن داده نمیشد، ما همچین جامعه بودیم و در شرایط سخت و هم به عنوان یک زوج لزبیان خیلی برای ما سخت بود. بعد شما
ترجمه. First of all, before I translate, I just want to mention that, Parveen is a lesbian and Afghan. She narrowly escaped persecution and arrest and detention by the Taliban on March 20th, and she's now in Iran. As you can see, she's not wearing a headscarf. She's very brave, and she's showing her face. As an LGBT activist in Iran, that she could face persecution by her host government. That's where she is right now. But she's willing. She doesn't want to hide. She wants to come out and show herself to the world because she believes that she is a voice and a vessel for lesbians and all bisexual women in Afghanistan in particular, who don't have a voice right now, who don't have, and who people don't know about their struggles. And I'm going to translate for her. She said that the experience of a lesbian, it's obviously a very bad experience, and I've endured hardships my whole life, and up until this point, obviously since the current regime has come to power, we've basically have no options. We have no other our outlet. We have no hope. There's nothing to live for.
What would you like to tell the other people who are listening here, who are participating here? And what would you like to say about the gender equality, particularly in the context of women and gender diverse people?
میگه به ارتباط برزمین مجلس که اینجا که هست بر مردم که اینجا هست پروین جان، شما به ارتباط مثلا حق مثلا خانما و حق به ارتباط جندر که هست، شما چی میخواین که بگوین؟ چی میخواین که برزمین مردم فامانده شوه که به ارتباط که تجربه خودتان و تجربه دیگه مردم ها که خانم هستن به حالت خودتان به افغانستان؟
خب اول که باید این صدای زنای افغانستان در اول باید بلند شود که زنها حتی نمیتونن بیرون از خانه بره، یا مثلا حتی حق کار کردن و بیرون رفتن از خانه نداره. و در همچین شرایطی ما میخوایم، در شرایطی که کسی نیست واقعا برای زنای افغانستان صدای بلند کنه. من خودم شخصا برای LGBT های افغانستان، همه جامعه LGBT هایی که در افغانستان خفا زندگی مونه، با ترس و لرز زندگی مونه، من صدای خود بلند میکنم، چون این یک حق طبیعیه، حق انسانی مایی که واقعا باید به ما داده شود. و من خودم با تیم روشنیا، با استاد نعمت سادات، ما تلاش میکنیم که مثلا صدای ما رو برسانیم و این حق ما رو بگیریم.
So basically, she would like to say, as the situation for Afghan women is deplorable. They cannot even leave the house. They cannot leave for work or for any other reasons. And in this situation, she represents, the lesbians of Afghanistan, the LGBTQ women of Afghanistan, the LGBT people of Afghanistan, who basically have no rights. They have no opportunities to do anything. They face constant persecution and risk in Afghanistan, and this is something natural. This is something who we are. It's our natural right to be able to express who we are and to have the dignity we have. So we are not going to stop. I'm working with Roshania, with Nemat Sadat and the team here, and we will keep fighting for our rights until LGBT people are free in our homeland. And we still have a very difficult journey ahead.
Has this the situation always been in Afghanistan, or is it only under the current regime?
چیز پروینجان میگه که این حالت که هست با افغانستان ای به همیشه تو بوده یا امیال که به ارتباط از این رژیم که هستک. و اگه میتونین که چیزای شخصی خودتان اگه تجربه خودتان بکنین، امی حالاتی که از وقتی که چند سال مدت تا نمیوزه که چه قسم حالاتی که زندگی شخصی خودتان بوده.
خب افغانستان یک کشور اسلامی بوده، چه هم در رژیم طالبان هم در جمهوری. در کل کشورهای اسلامی بعضی قیودات دارن، مثل ای که حتی در رژیم قبلی که جمهوری بود و در این رژیم هم ما شنیده بودیم که مثلا همجنسگراها شکنجه میشن، اینا مجازات میشن، زندانی میشه، چون یک کشور اسلامی و در قوانین اسلام یعنی همجنسگرا بودن یک جرمه و مجازاتش هم شاید اعدام بود، شکنجه بود، نمیدونم 100 و چند ضرب شلاق بود. و در رژیم طالبان که کاملا یک رژیم کاملا اسلامیه، کاملا از قوانین اسلامی پیروی میکنه. خیلی واقعا ما خیلی واقعا که ما مریم قبل از رژیم طالبان با هم آشنا که با هم بودیم چی بود زیاد سخت نبود، ولی دوره طالبان ما تا نمیتونستیم مثلا دست هم دیگر را در سرک بگیریم، در سرک در کوچک ما میترستیم واقعا. این که خیلی سخت بود و قانونی که میفهم ایره که مثلا طالب میفهمید مثلا ما همجنسگرا هستیم، ما مثلا همجنس خود دوست داریم، خیلی خیلی واقعا مثلا یک فاجعه میشد که ما چی رقم براتون بگویم. در کل شرایط سختی بود و اصلا به گونه اسلامیش بگیم حرام بود افغانستان. و تجربه
Basic. So she would like to say basically that the situation in Afghanistan is that whether this current regime under Taliban or the previous under the Republic era, basically was the dominant thrust was really Islamic law, and which basically spells out that there's no tolerance for LGBT people. We had no rights. We were criminalized then. We are criminalized now. The only difference is back then there was some space, there was some room. When basically Parveen says that when she met Mariam, it was during the time of the Republic. But even as the Taliban regime came, they could not even hold hands like in a street or anywhere in public, because out of the risk that they could be like singled out and targeted and persecuted. So there was no public displays of affection whatsoever that they could ever do. So because everybody everybody could potentially report to them. So one of the things that she just basically wants to say is that under Islamic law in Afghanistan, there is no chance for LGBT people to exist as long as the laws are dictated by these beliefs. Then we will never have rights. So that's basically she's saying that now it's so difficult right now because the Taliban have absolutely zero tolerance for any homosexuality to ever exist in Afghanistan. So we, in this situation, this is why Parveen now is left on her own, and Mariam, her lover, they were engaged to get married. One day, once they left, she's now being tortured and imprisoned by the Taliban, and she's now been in prison for over 1 month.
Anything else if Parveen would like to say? Anything else she would like to share?
بله پروین جان میخواد که بفرستان کنه که دیگه چیز اضافه شما میتونین گفتنی دارین که چطور نگفتین میخواین که بگوین که درتون اشاره کنین؟
چیزایی نگفته واقعا زیاده، ولی
به ارتباط خودتان مریم جان اگه میتونین توضیح بدین.
ما
Okay. She said if you could just give me 1 second. I think she's 1 second. She's gonna.
ما در کل تجربه سختی بود افغانستان، ای که ما همدیگر واقعا دوست داشتیم. برای داشتن همدیگر خیلی تلاش کردیم، بارها خودکشی های ناموفق داشتیم، ولی بازم با امید ادامه دادیم. امیدی که مثلا تنها چیزی که ما را امیدوار نگه می داشت عشقی که در بین ما بود و ما خوشبختانه تانستیم با استاد نعمت سادات تیم روشن آشنا شیم. مگه اینا نمی بود من خود تا اینجا آمده نمیتونستم و شاید دمو افغانستان میمردم. ولی واقعا خیلی نگران، خیلی ناراحتم که اینجایم و بدون مریم اینجایم و مریم در زندان طالبایم و ما این بریم واقعا خیلی سخت و قابل تحمله، غیر قابل تحمله و خیلی
فامیلتون فامیلتون چی
نه تنها
گفته؟
برای دوستیم میفجان که یک ترانسجندر بود و به تمام الجبچه افغانستان که امروزه نمیتونه واقعا حتی آزاد، حتی مجبور میشن که ایره دفن کنن در دلشان که ما یک همجنسگرا هستیم، مجبور میشن تن به یک ازدواج بدن، به خاطر تن به ازدواج اجباری بدن، به خاطر فرهنگی که در افغانستان است، به خاطر قوانین اسلامی. من از اگه صدای مرا میشنون، ما از جامعه جهانی حقوق بشر بارها خواستیم و بارها میخوایم که با ما با تیم روشنا کمک کنند تا ما بتانیم، هم مریم جان هم میف جان هم کسایی که مثل اینا در افغانستان هستن و نمیتونن، با سرنوشتشان معلوم نیست، شاید یا خودکشی کند یا تن به یک ازدواج اجباری بتونه تا آخر عمر مجبور به تحمل یک مرد شود یا حتی یک پسر که مثلا به هم جنس پسر خود مثلا حس داره مجبور شود که یک زن تا آخر تحمل کنه. ما واقعا این را نمیخوایم و ما تلاش میکنیم این را که بتانیم حق اینا را بگیریم و صدای ما را بلند کنیم.
Yes, so thank you for doing that. So Parveen is basically saying that, she she was driven by passion and love for Miriam, to be where she is right now as an activist, because that's where it all started from. It's basically, as a teenager falling in love, and then realizing that she could not be with her lover, and their families trying to separate them before even the Taliban got involved, their immediate family, and they tried to commit suicide. She has tried to commit suicide. Miriam has tried to commit suicide. They were unsuccessful, and they just realized that there's no other hope. They reached out many times to different human rights organizations, LGBT organizations, United Nations, whatever they could find for asking for help, and nobody listened to them. Nobody cared about wanting to even to try to help them, because a lot of them really realized that it was difficult for, um, you know, a single woman to get out of the country without a male chaperone, and they just didn't even bother. They just left her just hanging there. And the same thing for Miriam. She reached out to Roshania. She reached out to me, and basically, she's basically saying, like, making a rallying call. Please work with us. Please work with Roshania, because right now, I'm just devastated. Since the day that on March 20th, when Parveen, Mariam, and Maeve tried to evacuate and come to Iran, and from here they were going to continue their journey to go to Iraq, and from there hopefully get Western asylum. On that day, everything backfired, because the Taliban apprehended, detained Mariam and also Maeve, who was our transgender friend and worked with us, and they've been in captivity. Parwin luckily was able to get through to security, because her brother had allowed her. She gave her brother a cover story that there's an organization that's trying to help her to get out, but she did not mention it's a LGBT. And her brother, agreed to sign off as a male chaperone to give permission. So that's how she was able to get board. But on that day also, the Taliban were looking for her, because once they started the interrogation of Miriam and Maeve, they found out that Parveen is on the flight. They tried to stop the flight, but the flight had already left the gate. It was already on the runway, ready to take off. Literally, her life was spared within minutes. And now she's here. She's like, there's no way that she could have come out of that situation alive, because she's faced persecution from her own family. They're like, you've taken away, because the whole world now knows that Parveen is now the face of lesbians in Afghanistan, and she's interviewed with the media, and her face pictures are everywhere. So her family's trying to forcibly marry her. and she's said no, I don't want that. They did the same thing with Miriam. That's why Miriam wasn't able to get that male relative chaperone approved, because her family refused, and now she's in this situation where she's just begging, pleading for help. Please, the world, if you guys can do something to put pressure on the Taliban to release Maeve and Mariam, because right now we reached out. Parveen and I have reached out to Amnesty International, to Human Rights Watch, to the UN Special Rapporteur in Afghanistan, UNAMA, and many LGBT organizations, including other LGBT organizations that they say that they work for Afghanistan, but they have not done anything. They have not raised their voice. The only other organization that has really come through for us is the Peter Tatchell Foundation in the UK. And of course, the British media and other media outlets and organizations such as yourself, Sheehan Rights. But really, we're in this predicament that there's basically, Parveen is saying that there's many people like herself, like Miriam, like Maeve, who are on our list, who are left behind, and the world is not doing anything. So please help us so that we could get out, so that we could be free. And that's all we're asking for. Parveen John, did you want to add something else? دیگه چیز می‌خواستیم بگین؟
به عنوان آخرین گپای من به عنوان یک زن، به عنوان یک دختری که از دل جنگ، از دل محدودیت ها، از دل دردهای زنان افغانستان میایم و به تمام LGBT افغانستان صدای من میشنم قول میتون که تا آخرین لحظه مثل استاد نعمت که الگوی بزرگ است واقعا، من برای اینا کار میکنم و از حقوقشان دفاع میکنم، چون من از فامیلم گذشتم، از خانواده‌ام گذشتم، از همه گذشتم به خاطر اینکه بتونم یک روز بتونم واقعا حقوق ما را بگیریم، ما صدای ما رو بلند کنیم. این شر نیست، این ننگ نیست، بلکه یک حق انسانی ماست و به خاطرش من همه کار میکنم.
Basically, she's saying that she's lost everything. She's lost her family. She's lost her relatives. She's lost her community because of the fact that she came out, and she has said that firmly that she's going to continue this path until the very end. Even though she faces persecution, like I said, and even Mariam's family has threatened her own family, other relatives. The Taliban are searching for her. So she said that she's going to continue fighting. She said that even in her darkest and loneliest day, Roshania was there, and she considers me like her hero, because I stood by her, I supported her, and I will stand with her. And she said that because of that, she's willing to sacrifice her own life, because her life has been sacrificed, and she just doesn't want any other LGBT people to future generations to suffer the way that she has suffered, the way that Miriam has suffered, the way that Maeve and Miriam are continuing to suffer. She does not want that for anyone else. And she's taken this path, and she just hopes that she will survive, because she doesn't know what will happen. Because right now, she faces an uncertain future in Iran, because if her visa expires, they will deport her back to Afghanistan. And if that's the case, that you can 100% guaranteed that she will be in prison and tortured, and possibly face a death penalty for taking the stance for her and Miriam and Maeve to leave the country. And what she became successful, and she's still advocating. And that's not what this current regime wants. The current regime wants us all erased and eliminated, and we don't want our voices to get out to the world.
Nemat, please tell Parveen, whatever we have to say, that we salute her indomitable spirit and all force to her. And God has kept her alive, I feel, till this day, because she will be doing great things in future. So we have that hope. And this session supports the call for justice for Parveen, Mariam, and all other gender diverse peoples everywhere. Gender justice is a fundamental human right, and it is critical to advance progress towards all sustainable development goals. So do we believe. Please tell her that.
پروین جان میخواسته که بگه که ما بسیار زیاد شما برتان پیام میخوایم بتم. ما بسیار به احترامات بسیار بزرگ که اینقدر شما یک انسان بسیار قوی هستین. ما فکر میکنم که شما تا حالا که زنده ماندین از خاطر اینمی به اینمی هدف، اینمی کار بسیار روبرو و بسیار زیاد کاری که روبرو برتان مانده کار بسیار مهم است و از امو خاطر یک قدرت بزرگ است که شما را همطور قوی نگاه کرده و شما را زنده نگاه کرده و بسیار زیاد میخوایم که براتون بگیم که ما امرای خودتان، امرای مریم جان و امرای همه خانمایی که از امی شبکه ما که هستن که مشکلات امی میبینن، امی سازمان که اصلا شین رایتس امرایتان 100% استاد است و 100% ما شما را حمایت میکنن، صدایتان را بلند میکنن تا جایی که بتانن.
Thank
خیلی
you.
تشکر. تشکر که ما آدمای فعال مثل شما رو داریم که بتونن ما را که واقعا محرومیم کمک کنه. خیلی تشکر.
She said, "Thank you very much. Thank you for being with us, and thank you for everything you're doing and for giving us the opportunity to speak today."
Thank you very much. In fact, we have been very honored by her presence today. I now welcome formally Nemat Sadat, the CEO of Roshania, which is an advocacy network dedicated to assisting LGBTQIA plus Afghans. Roshania, Nemat, as I have read, it also refers to a historical Sufi movement in the 16th century, I believe, that challenged social injustices and inequality under ruling powers. And the same situation exists even now. Nemat is a journalist, novelist, human rights activist, and former professor of political science at the American University of Afghanistan. Known for his novel, The Carpet Weaver, and his campaign for LGBTQIA plus rights, Nemat is one of the first Afghans to have openly come out as gay and to campaign for LGBTQIA plus rights, gender freedom, and sexual liberty. And Nemat, as much as I know, the word Nemat means blessing or boon. Am I right?
Yes, that's correct. Thank you
Yes.
for the introduction.
Yes, and over to you now. The floor is yours, please.
Yes, thank you so much for inviting us to speak. We are very grateful for giving a chance for the LGBT Afghans from the Roshania network to have a voice here today. We have a list of over 1,000 people who still remain in Afghanistan. These are people who are vetted and approved to the best of our knowledge that they're LGBT people. Many of them, we are prioritizing those people who wish to be a human rights defender. To this date, we have supported the safe evacuation of 265 people to Western countries and Oman. And we hope that, Parween will also get to a safe place. I know that there was a question here, what does her future look like? At this moment, it's very uncertain because it's very difficult for someone to leave Iran to go to another, it's under sanctions, and it's there's 7 million Afghans in Iran. Many of them are trying to secure a humanitarian visa to go to a Western country. So it could take years, and she doesn't have that kind of a time frame. She has literally when her visa runs out. So we are trying to see if we can get her to another country in the Middle East or Africa, and where she could, obtain a longer, lengthier visa. And then from there, we could start the process for her to obtain a humanitarian visa or to basically help her start a life there, learn the local language, help her as much as we can until she gets on her own feet. And of course, she will be working with us. She was part of our organization. She's our program associate. And right now she is the most important voice right now because she's the number one target on the Taliban hit list or the Taliban kill list. People want, they know they cannot reach me. I'm all the way here in the United States, but they want Parween. They do not want a woman like herself because Parween is both a woman, she's a lesbian, and she's Hazara from Shia background. So she's everything that the Taliban absolutely hate. And so we must stand with her. I myself had been doing this work since I announced that I was gay back in 2013. And, we were advocating for rights and we saw the attitudes change. And really, when the Taliban came to power in August 2021, I realized that really the only thing I could do is to help save as many people. And that's what our focus has been. But right now, what we are trying to do is empower, give the tools and the training to human rights defenders such as Parween, such as Oslam and Merma and Hamid, and give them, these are our core team members who have become public advocates for the LGBT Afghan community, and giving them a chance to basically inspire other LGBT Afghans, that once they leave Afghanistan, that they show their face, they come out of the woodwork, they stand in solidarity with us, because there's strength in numbers. If we cannot fight a handful of people against Afghan society in Afghanistan, and more than millions of Afghans who live in the diaspora. We can only fight with sheer numbers, and that's what we're trying to do. Our organization, and trying to relocate as many human rights defenders who will continue to work with us in solidarity to work towards our goal. And hopefully in a post-Taliban world, in a world where democracy can reign in Afghanistan, we hope that we will be the first ones to return to Afghanistan and ensure that our rights are enshrined in the Constitution of Afghanistan, and that we basically become active participants, and we will never go back into the closet again. We will never, accept the fate that the Taliban wants for us, that we either, accept this doom, that we either kill ourselves or wait, a torturous death at their mercy, at their hands. That will not happen. That will not stand. We will continue our fight until we are all free, and I am sure that day will be within our lifetime.
Thank you very much, Nemat, and thank you for your positive attitude. And we need more people like you. And the sad part is that now this in other countries too, the anti-rights movements are gaining force, and they are actually threatening diverse gender people in other countries. And you are seeing what is happening in the US and elsewhere as well. So we need to be united in these times of difficulty, and I'm sure there will be a better future for all of us. Thank you very much for coming here today, and for bringing Parveen also with you. Friends, we now move to South Sudan. I invite Rachel Adao, Executive Director of the Women's Empowerment Center, South Sudan, which is known as WECSS. It works for the empowerment of socially disadvantaged women, youth, and excluded groups in South Sudan. Rachel is a fierce advocate for women's rights in Jonglei, South Sudan, and is also chair of Jonglei's Gender Champions Task Force. Welcome, Rachel, and the floor is yours now.
Thank you very much. Good afternoon.
Good afternoon.
Yes, I'm very sorry. I'm trying to open my video, but it can't open on my side, so I don't know.
Okay, at least we can hear your voice.
Oh, okay.
Now, yes, now.
I see you now.
Yes.
Okay. Thank you very much. My name is Adao Rachel, as I was introduced, so I will not introduce myself because of time. I'm a gender champions advocate in Jonglei states and also in South Sudan. Based on my experience, I work for Women Empowerment Center South Sudan, and Women Empowerment Center South Sudan is a women-led organization that aim to transform life and advance gender equality, equity, empowerment, and justice for sustainable development. We are having a program on women, peace, and security, strengthening women movement on women, peace, and security. And in this program, we are supporting a different group, the LGTB and the people with HIV, the sex workers, and the people with disability, the widows, and all excluded group. So in this program, what we do, we are empowering them and we are supporting them with the economic empowerment. But the challenge comes in when the excluded group, we give them their name, the sex workers, that they are young women with extreme conditions so that they are not victimized. So coming in, some of the challenges, I will say them as I'm presenting. So as the ongoing conflict in South Sudan has really disempowered this group, another group in South Sudan, they are disempowered, they are vulnerable, they are marginalized. So when it comes to the issues, so the gender justice, the issue of GBV become the issue. It is why it is spreading. When the conflict started, so people use it as a way of triggering the war. So there is physical violence, there is domestic violence, there is also sexual harassment, sexual abuse, there is conflict, also sexual. So all those sorts are happening because of the conflict that is going on. And also, it is also used as a weapon of weaponization of rape. They are also raping women across rampantly because of the conflict. There's also increased risk for the displaced women and girls in South Sudan. And also, there is also limited access to justice and support. When young women and the disability and the excluded group, like people with HIV, for them, they don't have easy access to justice and the support because of their condition. And as activists, we are trying to push for them, but it will become challenging also because we have some of the systems that are not well structured and the conflict is going on and the war. So people are traumatized and they are not willing even to support the vulnerable group. When it comes to the health sector, we are having a program that we are doing, integrated program that is on social behavioral change supported by UNICEF South Sudan, and we are doing it in Northern Barkazal. In this program, we have health, we have WASH, and we have other emergencies like polio, measles. So we have a health care system, all structure is breakdown. And you find the young women and girls, their reproductive health and the right is not at place. Few organizations that are supporting it, they have funding issues. And you find this one, it is affecting young women and also young girls. At the hospital, you find the maternal and child health care is at worst because the health facility itself has no services. We are advocating for them to go to the hospital to deliver, but when they are reaching at the facilities, there are no gloves, there are no bed rest, there are no midwife or mistress, they are not there. You find them, the child is coming with the head and or the hand, but there is no help of that woman to deliver safely. So you find some get their life in that process. So it discourage other women also going to the health facilities because it is have no help going to the health facilities, but no services. So it is better they delivered at home. When they delivered at home, again, also, there are a lot of bleeding and also losing life in that process also. There's also increased risk of communicable diseases like cholera. There is a high rate of there is a called Kiradim. It kills people. And right now it is still at high risk because they are bordering Sudan. And once they are using the river water, so with that one, once they take that water, it is just diarrhea straight away because it is contaminated. They have no access to clean water. And more other places that are living along the river, they are having issues also. And treatment for such diseases, yes, the Ministry of Health is trying to help, but the population at last is not receiving the services the way it is. Coming to the issue of food insecurity, seeing the conflict is going on, so the limited food people are having, it is only 1 meal a day. And you find the malnutrition in young women and pregnant women and children under 5 is at high rate. Anemic, so you find them what they are eating is not helping them. So there is a high rate of anemics and also malnourished children and also lactated mothers and also pregnant women. You find also there is a mental health issues in this process. So many are breaking down and they have mental disorder. And at the end of the day, you find no healing, so no psychosocial support. And you find when the head break down, the whole body also break down. When we come to the justice system in South Sudan, we are kind of depending, all the 64 tribe, we depend on our customs and traditional norms. And with that,
You are muted. You are muted. Please unmute. Yes.
okay.
Yes.
So you are getting me now?
Yes. Yes. No, really.
Yes, coming to justice in South Sudan, I say that our system, we have two systems. We have the constitution and we have the customary law. And in the customary law is whereby a woman is not supposed to speak in the public space, is not supposed to discuss in the decision-making process, or is not supposed to stand in front of male. And this system has really penetrated up to the national level, whereby there is a shrinking space whereby women movement doing advocacy for the sexual reproductive health right. So they don't want to hear such things to be promoted. And we find that young girls in school, we want them to educate them on the sexual reproductive health and their rights. Also, young women, you find them, they are not going to school. The high rate dropout from school among the girls is high because when they don't have sanitary or dignity kits, they cannot be in school because they are being laughed at. So they cannot have other avenues for them to keep themselves in school. And also some of them, they have low self-esteem, whereby they're right, they have a right over their voices, they have their right over their issues, and also they have their right also over their health and also reproductive health. But because of the custom and tradition, it tied them also to remain silent. So also part of it, the marginalization of women and girls, you find the women and girls are marginalized because in the family, men are the breadwinners. They have no access to resources. They have no access to decision making. They have no voice in leadership because they are always considered the minority because of the gender issues. And because of this one, when it comes to the justice part of it, even though you have a right to own a property and you follow your case, at the end of the day, you will be denied because of your gender, and there is no accountability for that. And also there is no accountability to the perpetrators of the GVV. So you see, the perpetrators will always go unpunished because of the what? Because of the weak legal system. The system itself is there, but to implement it or enforce the law, it is still weak because it is there in the document, but the institution concerned to implement it, they are not implement the laws. And the constitution is there. The constitution have the right, all the women to have the right. Article 16, all the women in South Sudan have the right. But that right, they cannot exercise it because you exercise it, you will be in jail at the end of the day. And also, you cannot be called to have a say in the decision making. It is always fear. And those fears, the shrinking space is not enough for all of us. When it's coming to, my time is over?
No, please speak. Please speak.
Oh, yeah, yes. Oh, no, I'm almost finishing. I'm summarizing it.
Yes, yes.
Yeah, so thank you very much for giving me this opportunity to share what we have. It is a lot. You know, when it comes to empowerment of women and girls in South Sudan, started with the justice, the gender justice, and the sexual reproductive health. But when it comes to the resources, whereby women themselves have no space whereby they normally gather, and they are also, they learn more about themselves. So the shrinking space, so being the health issue, being the gender issue, all these are also contributing negatively to the women in South Sudan. Thank you very much for giving me the opportunity.
Thank you, Rachel. And we are really living in such difficult times. From what you have said about South Sudan, of course, that is a conflict zone. But elsewhere also, things are maybe slightly better, but despite good laws in many countries, women are not able to exercise them due to such harmful social norms, and which are basically perpetrated by patriarchal powers. This is what I think. But all force to women like you, and we will keep the fight going on. And together, I think we will succeed. That is the hope I still have. Thank you very much, Rachel. We have
You're welcome.
We have Bertho Marxo with us today. Bertho is the Regional Community Engagement and Network Lead at the International Planned Parenthood Federation in its Arab World Regional Office in Lebanon. Bertho is a human rights defender and co-founder and executive director of Proud Lebanon, an organization that provides support for the LGBTQIA+ community. Bertho, welcome to this session. And will you please share with us how conflicts or other humanitarian crises impact gender equality and health in the context of your country and maybe elsewhere?
Thank you for hosting me. I just want to clarify that I'm no longer the executive director of Proud Lebanon since I joined the IPPF.
Okay.
Please allow me to share my screen because I've prepared a short presentation that could help us going through. Just a second. So I'll be talking about the support that IPPF gave to Proud Lebanon under the emergency grant that IPPF had. So just to give you a brief and summarize background on the situation. As you know, the war between Hezbollah and Israel escalated the following day of the war in Gaza have erupted. 4,000 people has been killed since then. 1,300 million has been displaced, mainly from the areas that were affected by the war, meaning the south of Lebanon and south of Beirut and the Bekaa. The war caused estimatedly 11 billion in damage and 9% decline in the Lebanon's GDP. We've seen that hospitals and healthcare facilities were bombed, and the local organizations played the main role in providing shelter, food, medical, or even mental health support. However, what we've seen, and we always have seen it, and I believe in other areas as well, we always realize that vulnerable and marginalized groups, mainly the LGBT individuals, refugees, people living with HIV, people with disabilities, elderly, and others are the ones paying the price more than anyone else in the community, in the society. So how this has started, how IPPF came to support Proud Lebanon. Well, IPPF have, as I mentioned, an emergency funding through their MAs. And Salama is the MA in Lebanon. Together, Salama and Proud Lebanon partnered to provide critical humanitarian support, focusing on sexual and reproductive health, mental health care, outreach for the LGBT individuals and the people living with HIV. Why is that? Simply because it's not only about services or aid as anyone else, but it's because things need to be done in dignity, protection, and visibility, so no one is left behind. Well, this support allowed Proud Lebanon to provide free medical services, including general practitioner, endocrinologist, infectious disease specialist, mental health support that we've seen, and we've realized the increase, and later on I will share the numbers that has been reached in that project. This support as well included psychiatric and psychological support and specialized specialized services for people living with HIV and the trans community when it comes to hormonal therapy. And Proud Lebanon played a very crucial service in ensuring that ARTs are available, even if the other centers distributing the ARTs has been affected by the war. Now let's talk about the numbers, so the figures. 473 individual sessions provided for 70 beneficiary, and we adapted in providing this service. So either it was physical, but mainly we were adapting to provide the support either through Zoom or even sometimes on WhatsApp, especially for those who were unable to reach the center in Beirut, the center of Proud. We provided 30 psychiatric intervention, and IPPF as well was able to sustain the services, the medical services Proud was providing, and 174 patients received essential care, mainly on sexual and reproductive health, and 36 trans individuals were able to meet the endocrinologist that was following up on their hormonal treatment and support. As for the HIV, 320 people were benefiting from the ART and the infectious disease specialist available in the center, providing free of charge support. Proud Lebanon provided 1,000 HIV testing and allowed to diagnose 10 newly persons living with HIV that were unaware of their status, and enrolled them in the care with the support of the infectious disease working at Proud. Proud Lebanon as well offered for 210 people PrEP and 15 MSM, males having sex with males, the PEP. In addition, Proud provided 30 group sessions. In the beginning, it was physical until the war have reached the capital, so they adapted their approach to provide it online. As well, the same thing goes to the campaign, to the outreach campaign that were taking place across the city. So Proud had this mobile clinic, as you see in the picture. They used to go in next to LGBT frequented venues to provide rapid testing and awareness and referral to services. When it comes to the visibility, Proud Lebanon worked on the U equal U campaign, which was crucial because we've seen, even though there was this war ongoing and so on, we've seen that stigma and discrimination against people living with HIV was still happening. So we've helped Proud Lebanon to organize this campaign, and it was widely disseminated over the social media with the support of the National AIDS Program and other donors. In addition, Proud Lebanon produced a video campaign with a public figure. His name is Fuad Yamin, for Human Rights Day, that was December 9th. The video campaign highlighted the importance of intersectionality when it comes to human rights and human rights violations. And it was really, it had a big impact, and we've seen the reach that it reached thousands of people on social media. In the beginning of the project, IPPF as well supported a very highly needed training on first aid mental health, because there were this flood of people approaching Proud asking for support. So IPPF supported the organization in building its capacities to provide the mental health, the first aid mental health intervention. So smoothly, the team trained would refer the people in need for specialized interventions provided by 3 different psychologists supported by the IPPF. Well, we believe that this is the type of solidarity. IPPF listened to the community. and found the needs in adapting its approach so it could come to the most vulnerable, because solidarity is not charity. Solidarity is justice in action. Thank you.
Thank you very much, Berto. And indeed, it is equality for all and all for equality. And solidarity indeed is not charity, it is justice in action. And thank you for sharing all the good work you all are doing despite the formidable challenges posed in a conflict situation. Thank you very much.
Thank you.
Now we will listen to Nelly Munyasia, who serves as Executive Director, Reproductive Health Network of Kenya. A trained nurse and a health systems and policy expert herself, Nelly is passionate about protecting reproductive health rights
in their diversity have access to comprehensive sexual reproductive health information and services. And so, of course, across the global south, we also continue to face a lot of humanitarian crises, and my sister from Sudan presented clearly what goes on in Sudan. We face floods, we face hunger, and we also face war. And women and girls continue to be the most affected, continue to be the most at risk, and more importantly, those ones that the LGBTQI community are most at risk and most affected. And when we think about all the iniquities, then it is them that suffer the most. And of course, when we have all this, we see a lot of increased rates of gender-based violence. We see disrupted access to essential services like education and healthcare. And we know that we have a lot of statistics that continue to show this. And then we also have heightened risk of women and girls, including sexual exploitation, and also early marriage and displacement. And when we think about displacement again, then it is a lot of times it's the women and girls that have been kidnapped, that have been hijacked, that try to even hide in case of the war, and they end up, they end up in the wrong hands. And so when we talk about increased gender-based violence, of course, we know that during the crisis, there's intimate partner violence. Then you end up, holed up in a house or somewhere with someone that you are trusting, but these are the people that then expose you to, intimate partner violence. We've seen young girls during this period being forced to get married so that maybe, their family can get cows, their family can get, goat or something in exchange. And we see, especially in Kenya, where we've had floods, we see that girls are left behind, because of the vulnerability that comes with being, a woman in your diversity. Then we know that a lot of times, then you are prone to a lot of harm, or especially from the other gender. Then, of course, the issue of disrupted education and healthcare. Of course, automatically, if roads have been broken, we know that girls are not able to cross over, women are not able to cross over the river banks, for example, and this then, this stops them from continuing with education. SRHR, access to sexual reproductive health care, is also affected, and we think about women that need to go for the antenatal care, for example, those that had appointment for their hormones refill, those that had appointment for contraceptives and family planning, the HIV patients that need their routine refills, they are not able to access this because of either conflict or the hunger or the flood crisis that exists. I talked about, of course, the heightened risk for women and girls, and of course there's the issue around displacement and the breakdown of social structures that exposes women, and of course increases sexual exploitation. The issue around food insecurity, it's at that time that we know that, men would maybe walk and will be able to, to, get food. But we understand, for example, women, they'll be holding on with the small babies, trying to take care of the household, trying to, see if they can manage to, ensure that they're not even losing out on property. And as a result, of course, they will not access food. And a lot of times we've seen that this is what even contributes to the mortalities and morbidities, the whole issue around nutrition and all. And then limited access to justice and support. And I think I do not want to overemphasize this because the previous presenters have talked about that. And just making it difficult as much as we have the policies, we have the guidelines, but it is at this time that they are not followed, they're not factored in, they're not implemented, and a lot of injustices are meted upon, women and girls and the LGBTQI community. So how is RH&K doing this? Of course, with support from IPPF to ensure that during crisis, then we are managing the issues that come up. Of course, we continue to be ambassadors, we continue to be advocates, we continue to raise our voice, we continue to work with government to ensure that we are implementing the constitution, for example, of Kenya, that recognizes everyone and emphasizing on health being accessible by all, regardless of your identity. So for us, importantly, is to ensure that we are creating awareness, we are advocating so that no one is left behind. And so prioritizing gender equality in humanitarian action, ensuring that our programming is centered around, gender equity and, factoring in cases of humanitarian crisis, how do we make sure that gender equity is still, maintained? We are still able to ensure that access to SRH services is available. Then protecting the rights of women and girls, and this is to ensure that there is access to essential services, of course, including education, healthcare, and psychosocial support. We know that the mental well-being of women and girls at this particular point is of importance, and we just ensure that we are putting in place call centers, hotlines, so that they can call in and speak to a counselor and be able to go through the psychosocial support that they so much need at that time. And then also we ensure that we are preventing and responding to gender-based violence. Again, we run a call center, Nena na Binti, loosely translated, Talk to an Aunt, and it is a safe space for LGBTQI community in Kenya. It is a safe space for access to SRHR counseling, mental counseling, and also, connecting you to trained law enforcers that we have trained on meaningful support during reporting, and also connect you to a trained healthcare provider whose values have been clarified to provide comprehensive services. But most importantly, also we have lawyers that are available to provide pro bono legal support. And also, promote economic empowerment. We understand why it's important to continuously invest and ensure that women in their diversities are empowered to access education, skills, training, and economic opportunities. And also strengthen legal and policy framework. I talked about this, just ensuring that national and international laws and policies that protect women and girls' rights and address gender equity are not only put in place, but they are implemented to the latter. And then strengthening health systems for resilient communities. And this is ensuring that communities that prioritize preparedness, collaboration and knowledge sharing are more resilient and can mitigate the impact of health crises. And also just looking at healthcare as a whole and ensuring that government is also taking leadership when it comes to responding to humanitarian crisis, ensuring that supplies and commodities are available, ensuring that trained and skilled healthcare providers are available, co-funding as civil society organizations fund humanitarian responses. How does government also come in place and ensure that they are co-funding? And but generally just having progressive transformational leadership that then understands and supports gender equity and ensures that it is implemented in totality. Thank you so much.
Thank you very much, Nelly. And thank you for voicing the problems and the great work you are doing. And we are in this fight together, as I have said earlier, all of us. And we join you in solidarity for what you have said for Parveen. We are all with her, whatever we can do. Thank you very much. And last but not the least, we are fortunate to have with us Dr. Ravi Verma, Executive Director at International Center for Research on Women, Asia. And also, he has been one of the commissioners of the Lancet Commission on Gender and Global Health, whose report on achieving gender justice for global health equity was launched about 2 weeks ago around World Health Day. Welcome, Ravi. We are keen to hear from you the highlights of this very important report.
Thank you. Thank you very much, Shobha and Bobby, for inviting me to this such stimulating webinar. And I'm so happy and proud to be part of a session where I'm hearing such powerful presentations of the frontline courageous warriors of human rights, from their lived experiences. They can't be more inspiring conversation than this. I thank you very much, and I congratulate all the speakers who have spoken before me, and I feel also feel relevant, in terms of how this report on gender and global health perhaps provides a small but very significant kind of a contribution to this discourse. Although written within the context of global health, this commission's report is a flagship one in more ways than one. First of all, this multidisciplinary report shows how gender and health nexus can be better understood and addressed to serve equity and social justice goals. To understand why gender presents such challenges for the global health sector, the Commission reviewed massive amount of literature, historically, social, political, legal, and economic literature to find and assess how some of these forces are at work in the gender domain, and including how intertwined are the issues of capitalism, imperialism, and capitalism in their effects on people's health, bodies, and integrities and well-being. We see this conflict, humanitarian crisis emerging out of all this history of colonization, imperialism, and capitalism, which has been brought out so lucidly. I'm so proud to be working with 20 other commissioners who are drawn from countries across the globe, and they represented various backgrounds. So I'll be at high level. I'll give an overview of this report at a higher level of overview. I'll not go into the specifics. I would really urge all of every one of you to please look at this report on the website of the Lancet, and make sure that you familiarize yourself with the kind of arguments this particular report presents based on extensive evidence survey and other processes that underwent. Our vision is actually centered around our call for gender justice in all systems of governance, health knowledge productions, and service delivery. So we call it gender justice. We use the term gender justice because it envisions a world in which everyone can thrive irrespective of their gender and gender identities. Gender justice predicated on the principles of non-discrimination, personal autonomy, and human rights more generally recognizes the diversity of needs and experiences. We call for the inclusion of all people and aim to achieve both equity, which is equitable distribution of sources, access, and opportunities, and equality for all. And in that sense, we have this report has first identified 3 entrenched biases in the global health. It's so interesting that for several years, gender has been talked and everyone has been mentioning this in the global health without even taking any deeper dive into this. And they continue to operate on three entrenched biases. And it's important to call them out. The first entrenched bias that the global health has demonstrated is that gender and sex can be used interchangeably. That is, gender equals sex. Now, we all know while biological sex can influence a range of bodily functions, including the immune, endocrine, and metabolic systems, as well as physical appearances. But what is important is to know that biology does not operate independently of the conditions in which humans are born, live, play, and work. And there are several behaviors that are associated with gender norms drive biological effects, including epigenetic modifications. And there is a accounting of that in this. The second entrenched bias in the global health is that gender relates only to women and girls. Although the term gender might seem ubiquitous in global health policies, programs, and commitments, global health practitioners and policymakers often use gender as shorthand for talking about women and girls, who are often framed as inherently vulnerable, rather than gender as a relational construct that affects everyone's health. This framing of issues, in fact, is very harmful. This framing of issues excludes the health needs of transgenders, all the gender divergent population from gender policy, and could suggest, in fact, does suggest that gender analysis has very little relevance to the health of men and boys. And that is how the global health has been dominated by this kind of bias, where gender is equivalent to the women. And third bias in the global health has been that gender has very little effect on most health and well-being outcomes. This is so interesting and so surprising that while evidence for health inequities between men and women and other gender variants is long-standing, substantive, and widespread, the global health community, practitioners, policymakers have shown a tendency to overlook the role of gender and health outcomes, except in relation to a narrow range of health conditions, mainly those related to the sexual and reproductive health of females and girls. And that too is not going full length. So going through, this commission was set up in 2020. Those were not the good days because COVID had just hit us. And the commission met twice in person, and then there were several online consultations. But the commission was supported by a lot of outside experts, and many studies were undertaken, small studies, besides getting beside literature search of the existing evidence and knowledge base. Based on that, we have identified 7 key issues. One is which I just alluded to, is bringing gender justice in health policies and programs and practices is important. The commission has highlighted in the report how programs in various countries across globe, if they have promoted gender equality, they have had much better and much wider outcomes, positive outcomes, than just about dealing the illnesses. The second issue is that definition matters. Sex and gender, we need to gather data and differentiate as to when we gather information on sex, why we gather, how we define, and when we gather information on gender, how is that measured, what are the definitions, and to what use we put it to. We have also identified the history, politics, and the power dynamics that shapes people's health and outcomes. And evidence, we have called for evidence on the local and context-specific data for getting the larger context of history and politics, and how power gets displayed in the local context. The other issue, which is of extreme importance in global health, is the role of commercial sector, which has weaponized gender, and it has truly played havoc and tobacco and alcohol is just one of the several examples, but there are many in how gender has been used by commercial sector to promote certain kinds of products and has led to the harm and lifestyle shifts that are not positive. Then the issue of how the workplaces have been are gendered, but they are not recognized for their gendered nature of the workplaces, especially health workplaces, where about 70 to 80% of the workforce is women, and yet there is no recognition of that. And then finally, we bring out a whole lot on how to hold powerful people or those who are in power to account, to hold them accountable. I think we have presented the report in a number of ways. There are almost 19 panels in the report, interesting panels that present case studies from across the globe to demonstrate what all issues I have highlighted, and how important they are in determining the health outcomes and the people's well-being, and how power dynamics truly impacts these outcomes. We have not only diagnosed and presented those case studies in an abstract manner. This report goes far beyond that and makes some tangible recommendations and to show how global health community of policymakers and practitioners can translate some of these abstract intersectional ideas into concrete actions and provide strategies that have successfully disrupted an inequitable system of powers and challenge the activities of the opposition. The pushbacks that have emerged in recent years much more strongly, but have always been there on the name of equality. And it's important that I think this is very important, that we should not recognize that arriving at gender justice for global health is not a technical exercise. This is an exercise in understanding people's lives, their history, the politics, the economy, their culture, and their local relations and context. And this means we must identify those spaces where power and privileges are exercised inequitably and find some ways to disrupt that. I think this is the crux of this report, where we are constantly calling for disrupting those spaces where the power dynamics are being played out, and no one, and people are just taking that for granted in smaller ways. So, and that means it requires a lot of tactics, a lot of strategies at multiple levels, and that means it would we have thought of, from examples, how to build coalitions, how to articulate shared visions, where and in what way use multi-level institutional processes or the processes that can impact multi-level institutional processes. We have found, we have indicated in the report how to find right policy processes and spaces for advocacy groups. Create a kind of engagement in social mobilization among like-minded and unusual allies. We have supported the movements that would support political and policy entrepreneurs in this space, or framing the issue compellingly to make sure that the idea of gender gets in. So the report, I'll just stop here. I know I have not gone to the specifics, but yet there's a lot of specificity here. There are 3 to 4 action domains identified in the report. That is how to share and how to develop a shared understanding and framing of gender justice and global health. And there are clear, concrete ways of arriving at this. Or how does one improve the evidence base in terms of collection, collation, and dissemination of data and for action? How to create support and support gender responsive health policy sector development. On the name of system strengthening, a lot of things that we do don't really get into the deeper aspects of gender responsive health system. And how does one create an accountable governance structure within the health system? And finally, and not the least, is how does one resource and invest in gender justice in health system? So broadly speaking, this is one of the reports that should be read by everyone. We are this was the launch that happened in Delhi. For the first launch is going around globally in different countries, and the commission job was to bring this out and publicize as much as possible. I'm very proud to be part of this, and hopefully this report would make some dent in the discourse on not only on health, but also on gender equality per se, and the nexus between health and gender. So thank you very much for your patient hearing, and I would really urge, request that please look at this report. It's an important piece in this time, in these difficult times, when there are dictates coming out from powerful nations and the presidents against gender, and where there's a, when I say weaponization, where the counter narratives have been created to confuse this entire issue of men's health, women's health, and the gender, the identity politics has literally obscured anyone, all of us, to move our agenda to upstream, normative and the power analysis of how we relate to each other between countries, within countries, across nations, and how different vested interests continue to manipulate all of us. So, and in that respect, this report is bold and is it says all these makes all these points with evidence, and also makes a suggestion as how to move forward to the next step. So thank you, Shobhaji. Thank you.
Thank you very much. Thank you, Ravi. And of course, the next steps are that we bring the suggestions to fruition and they are implemented. And that is where accountability also comes in, as has been said in the report as well. And also one point which I remember, part of which I have read, is having gender segregated data. Data is very important, and normally in many countries, we are not giving segregated data. Thank you very much. We now open for comments, reflections, and questions from the audience. Please type your questions in the chat box or raise your virtual hand if you wish to speak. There are many comments there in the chat box. I will read them, but I think Nelly has to go somewhere. So there are questions for Nelly. There is a question from Kathy Makanga. She says, an important presentation, Nelly. Kenya government has also signed problematic regressive Geneva Consensus Declaration. How do we make sure that Kenya stands up for constitutional rights and not let regressive efforts like GCD negatively impact the country? Nelly, would you like to answer?
Thanks. Yeah, thanks, Shoba. So Kenya has not only signed to the GDC, but in May, we will be hosting the so-called Family Values Conference. And that is more problematic because then this is, creating an environment for the anti-rights movement to penetrate deeper into policy-making spaces and also tend to influence how policies are made in Kenya. We know that just before that, they'll be having a conference in Entebbe as a pre-conference through the family values. So, of course, Kenya has signed to it. We know our first lady is targeted as one of the key persons that will then be like their representative in Kenya. And so we continue as a movement to call out and speak against this against this retrogressive group of persons, individuals who purport to be, ensuring that they restore African values, and whatever they're trying to preach is not African. When they talk about killing of the LGBTQI community, when they spread hate, when they talk about polygamy, Africans are polygamy. We grew up in polygamy. We never had a God. We had our own way of praying. In Kenya, as a country, it does recognize the intersex persons. And so we are working together, and what we are doing is working as an intersectoral movement where we are not only working as the gender activists or the feminists or, people that traditionally are part of the civil society organization and the feminism movement. We are working together with people from research, and Ravi, just to mention that we work with your colleague Evelyn in a big way to ensure that we are generating evidence that then we use for our advocacy efforts. We are also working with policymakers themselves, appreciating that the kind of work we do around access to service delivery, it's the responsibility of the Kenyan government. It's not the responsibility of the civil society organizations. And Kenya's constitution is very clear in terms of providing services to all, including reproductive health services, but most importantly, protecting life. And so for us, we are not focusing on the kind of disinformation peddled by the anti-rights groups. We are focusing on ensuring that we implement the constitution, we hold government accountable, and also supporting the government so that when opposition strikes, then they're in a position to deal with the anti-rights groups. Of course, we are in for the longest haul. We know that they are well funded, well coordinated. It's a whole global to local movement that is working strategically to make sure that they're taking on even on the gains that we have made. And so we are not going to be gagged. We are not going to stop. We are going to ensure that everyone enjoys their rights, not only in Kenya, but Africa as a whole. Even for the conference that they're trying to convene in Africa, we have called out on the hotel that is hosting it because they are a recipient of the Global Fund, and Global Fund gives resources to taking care of HIV people, including the LGBTQI community. We are calling out on any government representative that is being part and parcel of that convening and trying to sensitize the community so that they are aware that this convening coming to Kenya is spreading hate, disinformation, and not aligned to the Constitution of Kenya. I can talk over and over because opposition is something I'm very passionate about, given that even our own healthcare providers are arrested every day for providing safe abortion services, which is enshrined in the Constitution of Kenya. That is how far the opposition has gone to make sure that they are not seeing anything around reproductive rights in the global south. There was also the question around what strategies do we put in place to ensure that there's access to services during humanitarian crisis. And we know that during conflict, humanitarian crisis, we cannot work alone. So there's what we call the working together as the community, and also having a disaster responsive strategy, which was of course led by the government. We cannot work without a guide that is provided by the government. So having a multi-pronged approach where we have a whole strategy, we have government, we have security agency, we have healthcare providers that are trained, we have commodity and security in place. We have at the communities where we are working, we ensure that the community is well informed, the church is well informed, because a lot of times where we have to provide services, we'll be providing these services in churches where at times they're even housing the people that have been affected by the humanitarian crisis. So really just coming together as a sector, ensuring that it is holistic, and also ensuring that there's the component of psychosocial and mental support, as I had talked, because we know that a lot of times those affected by the humanitarian crisis are also affected mentally, and ensuring that providers are working on a rotational basis so that services are provided continuously. But most importantly, is taking these services to where the people need them, to where they are, because at times they might not be able to come to facilities, or they might not even be able to come to where you put the outreach. So you have the mobile and continuously continue moving around and ensuring that these services reach out to those that have been affected by the humanitarian crisis. Thank you so much.
Thank you very much, Nelly. Thank you. And would any of the other speakers like to add to that question about what needs to be done to ensure that access to SRHR services continues during conflict and other crises? Would any other speaker like to say something there?
I would like
Yes.
I would like just to highlight that sexual and reproductive health are basic human rights, and we should not neglect them even during crises like war or floods or anything else, because they are there, they exist, and we need to acknowledge them. You know, we need to keep an eye on this as well.
Yes, yes, thank you. And there was a question for you also that ensuring ART supply is really important, and same goes for other essential life-saving medicines for chronic diseases. Any lessons for governments to better prepare to ensure supply chain? What can be done in that case? You had asked, yes, but
Based on my personal experience, you know, during the not only the recent war, but we had the Beirut explosion 2 years earlier. During the Beirut explosion, the ministry adapted its approach, and they learned that they need to build alliances and to get the support of the NGOs when it comes to the sustainability in ART and other medications. So I believe this partnership is crucial, and it needs to go beyond crisis. And this is why I call all the participants here to take the lead in approaching the ministries in our countries and engage with them, so we can keep our services, the basic needs of our communities, sustained even during conflicts and war.
okay, thank you. There is a question for Ravi from Patricia K. of South Africa. Patricia wants to know, are there any specific recommendations for specific countries or governments in the report? And will it be presented to governments as SDG 5 review is happening this year? Ravi.
Well, thank you very much for asking that question. And I think, you know, the challenge for this kind of a commission working on global health across and addressing issues or drawing evidence from hundreds of countries where there is any evidence that exists worth reporting, we have to strike a balance between what is the country specific versus what gets into the larger global health domains. So this report does not make country specific recommendations, but does make recommendations that are fairly applicable to all the countries. We think that global health, in the manner it has manifested itself, or it has impacted people's lives across countries, has certain common features and characteristics. And I think it's important to recognize them. And every country can draw the specific examples and specific ways to translate those recommendations in their context. So yes, it's extremely relevant to all the countries. The Commission has taken care of one thing, is diversity, in ensuring diversity in bringing the case studies and examples, both the concrete examples of how gender equality works and also the examples where it has disrupted the health. So there are so one needs, at the country level, these reports have to be discussed and needs to be deconstructed, applied, and see how best some of these recommendations can translate. And so yes, I mean, as commissioner, as one of the commissioners, I suppose our responsibility was to the extent where we could put together a credible, evidence-driven kind of framework with concrete recommendation, forward-moving recommendations. Now, I think it's a global community. It is out in the space. It is for the global community. I'm so happy to be sharing on this platform. There are many of my colleagues within the commission. They are sharing, and they would be sharing all on different platforms to make sure that the recommendations made here are not lost into these pages, but they are talked about. And there'll be many writings coming out. There will be intentional reach out to the governments wherever it is possible. And we, as commission, the commissioners would be very happy to participate in some of those conversations, to bring in their own insights from concrete examples. So, Kathy, I'm not sure if I've answered to your satisfaction, but yes, this report and the content are important eye grabber. They will definitely draw attentions. That's what we are confident.
Thank you. Madhu Sharma has raised her hand. Madhu, yes, please speak.
Hello, good evening to everybody from India. And I just wanted to have experience. I mean, it was wonderful to have such rich experiences from across the globe. And I believe gender, health, and humanitarian efforts, and these are already very well linked and well acknowledged, not well addressed, though it's in work in progress. But recently there have been trend to have politics of gender, maybe, and where, I mean, rapes and gender-based violence have always been a sort of power play, to show the power, this thing. But recently this has been further misused by politics, the local politics. And say the people or certain caste being raped to show down the party in power, or many other, or playing around dress code, burqa codes, whether that can be where there is a division of educated, non-educated, all those, there are differences of voices coming through. So in humanitarian efforts, this gets further exaggerated. So are the people, can some of the speakers share their experiences, whether they faced such things, on if so, how they addressed?
It's an open question. Any of the speakers, if they would like to answer, please. Any of the speakers? Rachel? Rachel there. Madhu, can you please repeat your question? Then Bertho can answer. Can you please repeat your question?
Hello?
Yes. Just repeat your question in one sentence, perhaps. Then.
Yes, the issues of health, gender, displacement, humanitarian distress, all are interlinked, and we know that they are difficult situations. But one thing that further exaggerates these situations or such distress is the politics, the local politics. And if some of the speakers have felt the same, and how they address.
Madhu, it's for sure politics playing an important role in segregating people, but as well in providing the essential services during a crisis. I've always seen that. And this is why, it was very important to seek support from like-minded organizations and donors, because even when it comes to, I'll give you an example, during Beirut explosion 2 years ago or 3 years ago, we've realized that support came for families and they neglected the single people or trans individuals. They were left unassisted. This is why during this war that erupted in Lebanon, we tried to cover this gap by offering the services needed for the community, because we've seen that they are left behind. And this is why IPPF came in and funded Proud Lebanon in this very important and highly needed intervention.
Can I also quickly respond to this, because Commission dwelled on this issue at length. We have entire section on history, politics, and power, what Madhu is alluding to. How gender is understood within the global health is influenced not only by the politics, but also by the history and the power of those who are setting the agenda. The history, if you look at the history of research in health, global health, they were all determined by who is in the power and what kind of health outcomes or health research one needs, which research gets funded, which research does not get funded, is a matter of politics of power, who wants to commercialize even health research. A lot of, we have seen how gender is framed, understood, researched, and acted upon. And if one takes a deeper dive, one would understand where are these contestations coming from, where and how, who is benefiting from this health research or health findings, who is included in those evidence creation and who's left out, what is asked and what is not asked. So, and there is a very deeper reflection on this issue, and that's why what we call for in this commission report is democratization of evidence building, contextualization of building evidence for action, and as a result, to break that power dynamics in how agenda is set and what gets defined within the health outcomes and health agenda. We need much wider. The first point of that disruption is how you democratize the data gathering, coalition, interpretation, and contextualize that. And that would determine what actions can be taken to disrupt those spaces. Yes, thank you for asking that question.
There is a question for Nemat. Patricia wants to know, apart from writing, how can we help support? Is there a petition?
Yes, thank you so much. Yes, unfortunately, we didn't do a petition because I think what's more important than a petition is really to really the organizations that can make a difference here are Amnesty International, Human Rights Watch, UN Special Rapporteur's Office on Afghanistan, Richard Bennett's office, and also UNAMA in Afghanistan. These people, and also like other Western governments, obviously in the United States, I don't think that the Trump administration will help to do something to release Maeve and Miriam from prison, but it's worth a try, and we must continue reaching out. Have reached out to many organizations. We've reached out to France's LGBT ambassador. We're asking other countries in the West that, if the US right now is not standing up for LGBT rights on the international stage, we're asking other Western countries to come through and to put pressure on the Taliban. We see right now that the Russian Federation just recognized the Taliban regime as a legitimate government of Afghanistan, and they're very close to getting this recognition by Western governments. And so we have to tell them, no, we cannot recognize this government if they will continue to imprison and torture our people. And I think that we should do a direct call. That first, immediately, because there's many other LGBT people in our list. We have 825 documented cases of LGBT people who have been arrested and detained, tortured, who have gone missing, who have been murdered. We have to basically say, you know what? Show us, if you want to work within this international community, you need to release Mariam Ravish and Maeve Alcina Piesco and anyone else who is there just for the sake of their identity, for being because of their sexual identity, sexual orientation, gender identity. They must be immediately released and allowed to evacuate the country. So that's what we're calling for. That's what we're asking. That's what we're demanding. I think we should be a direct demand. And right now we need all the help we can get. If there's anybody that'd like to reach out to me directly or to Roshania's social media platforms or our website, please do so, and we would love to work with you.
Thank you, Nima. Thank you. Dr. Siva Prasad has raised his hand. Yes, Dr. Siva Prasad. Please ask your question. There's a question from, and this I think we will take as the last question because we have already overshot the time. There's a question from Wanjiku Wanjohi from Nairobi, Kenya, that as a youth passionate in SRHR and gender justice, and I'm looking to contribute to positive change, what mentorship opportunities are there for us young people? Any of the speakers? Rachel, would you like to address? Or Bartho?
You're asking me?
Yes, if you can just satisfy his query.
Okay, you repeat the question.
Yes, that Vanjiku wants to know what mentorship opportunities are there for us young people who want to work in the field of SRHR and gender justice.
So the mentorship, I believe, first of all, you need to believe in what you're doing. Do no harm is number one, but most importantly, not to put yourself at risk. It's true that we need to help others, especially in crisis time. However, we should not be in danger so we can continue what we're doing. And to be inclusive, and which means leaving no one really behind.
Thank you. There was a comment from Baijanti Bor. Baijanti says, very informative and interesting session. We need a gender-friendly health policy which is applicable to every nation, and politicians must understand before starting their career that gender discrimination could not bring peace and justice in the world. Yes, it has brought a lot of chaos, I think. And so politicians need to understand, because politics is the ultimate determinant of. With this, we come to the close of today's She and Right session that was co-hosted by SEDI, IPPF, ARROW, WGNRR, APCAC, and CNS. My sincere thanks to our esteemed speakers for their valuable feminist insights and to our participants for their lively inputs. Thanks also to Dr. Reddy for live streaming the session on his TV channel to help promote the cause. Special thanks to those who have been consistently reporting on these important issues. To quote the Lancet Commission on Gender and Global Health, it says, "We are in the fight of our lives against the anti-gender rhetoric and the rollback of gender rights. Now is a crucial moment in time to turn the tide on the rise of anti-gender rhetoric and to increase understanding of the importance of gender in public health." Quote unquote. Friends, let us work together for a feminist and gender-just inclusive world order where everyone has equal rights, equal dignity, and equal access and control of resources, irrespective of their caste, creed, or gender identity. Bye for now, till we meet again next month. Please stay connected and in this ongoing struggle against violence and abuse to protect our rights. And yes, gender inequality and toxic masculinity must end with us. Thank you for being there.
Thank you so much. Bye-bye.
Bye.